Hi, everyone, and welcome to today's live webinar, When Billing Becomes a Burden, What Chiropractors Can Do. We are so glad that you guys are here with us today. If you're part of a chiropractic practice feeling the weight of billing challenges, whether it's staffing, collections, or just keeping up with admin demands, you're in the right place. Now, before we get started, just have a quick housekeeping notes to make sure that you guys get the most out of today's session. First, we want you to go ahead and say hi in the chat and let us know where you're tuning in from. We always love seeing where everyone's joining us from. Now, if you have questions during the session, make sure that you pop them into the questions tab. And we're going to have time at the end of the session for a live Q&A, so don't be shy. We want to make sure that this is as helpful as possible. We'll also be launching a couple of polls during the session, and we would really love your feedback. It'll take just a second, and your input is very important to us. Yes, today's session is being recorded. So if you have to hop off early or you want to rewatch anything later, don't worry, you'll get the replay link in your inbox as soon as we wrap up. Lastly, keep an eye out for a quick survey in that follow-up email. It'll only take a minute to complete, and it helps us to shape future sessions that hit the mark. Okay, now that we've got that out of the way, let's meet today's speaker. I am so excited to announce Christine DeFrancisco, our Vice President of Revenue Cycle Management Operations. Now, Christine brings more than 25 years of experience across healthcare, from hospitals and ambulatory care to clinical research and health IT. For the last 8 years, she's been focused specifically on revenue cycle management for small market healthcare organizations, helping them stay financially strong and operationally efficient. Now, she knows the ins and outs of what makes a billing system work and what happens when it doesn't. Today, she's going to walk us through the real costs of keeping billing in-house, the power of outsourced solutions, and the critical KPIs every practice should be tracking, regardless of who's doing the billing. Christine, we are so glad to have you with us today. Now, I'm going to go off and you take it away.
Thank you so much, Malika, for having me today. I'm super excited to discuss simple ways to modernize your current practice operations. I'm going to focus on 4 specific themes today. I always like to start with the current state of the market as it shows key drivers and how we modernize the practice and take advantage of these changes as they come about. And then I'm going to talk through the continuing challenge of hiring and retaining qualified staff. This is, started really in the pandemic, but is not going away, right? And so how do we overcome those staff challenges? And then my favorite subject, I'm going to talk about key performance indicators, or what we call KPIs, that are the critical foundation of your business. We have baseline measurements and how to track not just financial, but also clinical sort of measurements for sort of patient throughput. And then I'm going to tell you my favorite ones that I track when I'm doing consulting for practices. And finally, I'm going to tie that all together with how we leverage what we call in the business economies of scale to bring your practice to the next level. So let's jump in. There we go. I want to start with the unbelievable hockey stick-like growth that our market has seen over the last 5 years and what the market is projecting the growth to be over the next 5 years. So the current chiropractic market is valued at over $450 million and is anticipated to grow at what we call a compound annual growth rate. And you can see that on the right here, that's referred to as a CAGR, and that's at 26%. So we are expecting this continued hockey stick growth to not end in the foreseeable future. Most medical specialties benchmark their CAGR between 6 and 15% over the next 5 years. And so you can see that this market is slated to grow between 200 and 300% faster than the rest of general medicine. This growth is inherently great news, but it does present challenges in managing the business. I have a couple of other key statistics that will really define the market growth, including the Bureau of Labor Statistics reporting that 38,000 chiropractors are currently employed today. And according to the American Chiropractic Association, chiropractors provide treatment for over 35 million Americans every year. The single biggest driver of this change is our aging population and the management of chronic diseases. We're managing now arthritis, degenerative disc disease, joint pain, and those are all really encompassed in that chiropractic care. Many seniors are also going and seeking chiropractic treatment for mobility, balance, quality of life. And we have this overall mindset shift from, acute maintenance or acute issues that come up in our lives to prevention and maintenance. And of course, when we're treating older patients, we have to take into consideration, training for age-related concerns like osteoporosis, fall risk, polypharmacy. But outside of the aging population, there are numerous additional reasons for the balloon growth. The second biggest significant market driver is the demand in non-pharmacologic pain management. The widening acceptance of treatments by patients who choose non-invasive modalities for chronic pain has been a market shift and one of those key factors in driving the growth. Because the risk and the rise of overuse of prescription pain medication, there is this awareness not just among patients, but also referring providers who are now looking for non-opioid options for pain management. Even, states' Medicaid programs are now expanding to cover chiropractic care as part of their opioid reduction strategies. We are also seeing chiropractors be part of that multidisciplinary team, especially in physical medicine, occupational health, VA systems. This has allowed for the diversification of services into massage therapy, nutritional counseling, wellness program, and we are evolving more and more out of the strict cash-based business into this, cash plus insurance-based market. And that allows us to have a more comprehensive view of how we're treating the patients. And the final market driver I really want to highlight is the growth of private equity-backed groups acquiring independent clinics and creating regional or national brands. While this isn't necessarily driving growth, it is impacting the privately owned groups and venture capital and private equity increased competition around negotiating payer contracts, marketing. It also affects our provider and staff retention. And we are already seeing PE groups offering more competitive salaries, benefits, growth opportunities for employees, which draws talent away from the small practice. Additionally, private equity and VC-owned groups can centralize their operations to centralized billing teams, centralized marketing and administrative operations, which reduces their overhead while increasing their overall profit margins. And this makes it harder for the independent chiropractor to compete with cost and efficiency. So for the small practice market, these market pressures and business fundamentals are essential. Success means focusing on both the patient-centric care, which drives loyalty, trust, retention, while not losing focus of your operational and financial strategies to maintain a strong and scalable practice. Regardless of the industry, success in a business means, consistent cash flow in the door, or as I call it, cash is king, right? As overseeing the revenue cycle management departments over many years, we can't operate without bringing cash in the door. So that's why I created this model as the central sort of pivot in this wheel. And there are countless factors that influence cash flow, but they're generally grouped within these 6 overarching categories that are all interconnected. I'm a super process-oriented person, so I'd like to start at what we call the beginning, which is getting patients in the door, right? And that's marketing, understanding your competition in the market. So I could spend an entire hour on how to address market saturation and competition. And I've already mentioned the consolidation with, private equity firms, sort of gobbling up our independent practices. So I'm not going to go into a lot of detail here, but really what I want to focus on is, the fact that when you're dealing with competing against PE firms and larger groups, right, they leverage economies of scale, right, where they can consolidate all of these functions into one generalized operation and they can get it for cheaper that way. I'm going to go into that part of the presentation in a moment, but and what that allows for when the business operation is not all up front, then patients are really the primary focus of the practice. And they get that convenient, easy access, sort of one-stop shop environment. And today, patients are primarily driven by those kinds of things, right? They do not want to go one place for their, massage, one place for their adjustments. And so this is really where, where we tend to struggle in this market. But also additionally, I'm going to go into a lot of detail about this, is staff management. Like I mentioned before, labor shortage didn't begin with COVID, but it's not going away, right? That many cases, it's intensifying as we are growing and expanding our operations. We need to make sure that we are getting qualified staff who understand both how a chiropractic office works, both how to help run your business. And that really impacts your efficiency as an operation. It affects that patient experience and the overall patient capacity. Patient retention, right? You can get them in the door, but if they're not going to continue to see you, then all of your marketing and all of that work you do up front can be lost. So attracting those new patients is super important, but ultimately the retention is your long-term success. A strong doctor-patient relationship is the foundation of retention, but there are also many other things like effective communication from your staff to the patient, right? Clarity around the benefits and costs of treatment. And this is going to be more important as you're expanding out of the cash-based market. Of course, convenient access, making sure you have, scheduling options. Patients are not waiting in a lobby for their appointment is another really important point. And then I know nobody wants to talk about this, and this is usually when people start, yawning in a presentation, is when we start talking about documentation and regulatory burden. But when you go from a cash-based to an insurance-based business, that this is one of the keys to keeping yourself afloat, right? Doing things appropriately that are going to get you paid by the insurance is time consuming, but it's also required. If you're doing Medicare or personal injury, it's imperative that it's done correctly and timely. Remember, in many states that require you to send PI cases out within 30 days to secure timely filing, right? We know Medicare generally has 365 days, but those PI cases need to be addressed immediately. Many of these payer requirements also include, documentation around functional impairments, treatment goals, measurable progress to justify ongoing care, a detailed treatment plan, appropriate coding. All of those are really required to get the insurance claim paid. Now, because of these complexities, I have actually hired a revenue cycle leader who's the director of quality and compliance to my team. Her name's Gina Serrato, because what we want to do is make sure that when you are working with the insurances, that you don't get paid today only to have it taken back 6 months from now when, Blue Cross Blue Shield says, nope, you shouldn't have been paid on this. So, we are starting to leverage that. We're going to have a bunch more webinars with her specifically to how to document to get yourself paid. And then, managing these payer complexities. The insurance billing, personal injury claims are those big, hairy behemoths of managing a practice, right? Especially as we're converting more out of the cash-based business into the insurance market. The biggest complexity in insurance management is variability between what insurance coverage, whether you need authorization, whether, how many are approved. I have hundreds of examples, but I will give you one, right? There, like when you are dealing with Blue Cross Blue Shield, oftentimes, first of all, Blue Cross has numerous different programs, right? They have Anthem, they have Blue Cross Blue Shield Federal. We have ASH, right? Which in the chiropractic world, even among the blues, you are going to have different requirements for authorization, for the number of services approved, and what is required to get that claim paid. And all of these are very specific nuances. And again, we're going to have more webinars specifically around payers specificity in chiropractic and personal injury work, because those are so specific in this world. Chances are we're going to also have to do it for Medicare, as we know that Medicare covers chiropractic for spinal manipulation only for subluxation. They don't cover exams, they don't cover therapies, they don't cover wellness. So it's really limiting our reimbursement potential. And then, of course, we have technology integration, right? Are you leveraging all the components of the ChiroSpring platform? Are you making sure that you're using our integrative clearinghouse, which is TriZetto, and making sure that you are tailoring, your documentation within the EHR so you can ensure that you are dealing with those payer complexities and those regulatory burdens. So when I talk about all of that, really, what does that mean for your, growth challenge with hiring and retaining staff, right? This is a strategic risk to financial performance in the chiropractic market, right? Where, we have staff turnover rates, front desk is averaging in a chiropractic office that you have about 40% turnover in the front desk. Your business operations, which is your back office team or your office manager, that's a third turnover rates. And we're seeing a huge amount of provider turnover. Again, a lot of that has to do with this consolidation with private equity and venture capital. And of course, our advanced practice providers at 25%. So really, this ends up being a complexity because as our profession evolves, the ideal staff member has to juggle multiple roles, right? Your front desk has to be patient support, customer service. They may have to deal with retail sales, which require inventory management. And your advanced practice providers have to, maybe doing clinical testing, such as range of motion, postural assessments, orthotic scans. And then your internal staff then have to be experienced billers, where they have to understand insurance benefits, not just whether or not somebody has insurance, but understanding verification, benefits, balance billing to patients' accounts, how to send claims, how to work that AR follow-up. So traditionally, if you're hiring one or two people in your office, they have to be, they have to be able to do all of that work. And in addition, your office manager has to do things like payroll, compliance, ordering, paying your bills, things like that. So what we're looking at is really staffing for the impossible, right? I probably should have named this slide Staff Unicorns. Like, how do we find somebody that can wear every one of these hats? It is a rare combination of having those skills, also being adaptable, efficient. And, that's why we're seeing these staff turnover rates in the chiropractic setting. And of course, we have other market competition, wage, right? The retail, tech, and other industries have raised their wages and offered more flexible schedules, right? Work from home, hybrid schedules. And that's drawing our front office away, or our administrative staff away. And this is even compounded in lower wage regions. So medical practices are struggling to match these offers because we do have reimbursement limitations and thin margins. So we cannot necessarily offer a front desk person $25 an hour, but they can get that, in certain, retail spaces. And of course, inadequate pipeline of trained professionals. Our team members now need to be trained on payer requirements, customer service. They have to be tech savvy to manage, how the day runs within the software. They need to know chiropractic specific aspects of the business as well. And training programs have not kept pace with demand. And so, and practices struggle to carve out time to do ongoing staff development. So the combination of not having true training programs, not having time for staff development, really ends up being that sort of two-headed monster. And again, in more rural or underserved areas, this factor is compounded. And then, of course, we have increased patient demand. I already sort of talked about the aging population with, and the increase in non-opioid pain management. But there's also another factor, and that's what we call the Gen X. The Gen X factor is a significant portion of our current workforce that's nearing retirement age, and they are way more inclined to prioritize holistic health and wellness than previous generations. So they also tend to be more tech driven and want that personalized care. And they don't have brand loyalty, right? My dad has seen the same, providers, his same chiropractor, his same internist for decades. Whereas me as a Gen Xer, if I'm not happy with my service, I'm going to go find a provider that meets my schedule or my, customer expectations. And so they're going to want, some of, access to their medical records. They're going to want, convenient tech-enabled practices. And of course, we've already touched briefly on the administrative burden, but this is really important when you're talking about customer service. Customers want to understand their costs, and they're going to want that up front. So you're going to need somebody up front who's going to be able to understand what that burden, what the cost of that is to our patients. So, they don't get any surprise, bills later. And of course, because of our thin margins, we do, often, have limited career growth. And a lot of these PE firms can have somebody who, is, sort of a back office person go from being a biller to being a supervisor to a billing manager, and up. And we just don't have that career path. And of course, I've already mentioned the geographic disparities and of course, the lack of flexibility. So, when you look at it this way, we really are, unique in the kind of burden that chiropractors are faced today that in some ways other, parts of business or medicine are not necessarily burdened with. So I know this is super busy. I just want to show you when we are looking at that wheel again, how intensely complicated this got very quickly. And again, making sure cash is king, that, when we are talking about, chiropractic specific issues, again, I want to, call out, things like, timely filing when you're managing payer complexities, where PIP claims have that shorter window. And then you have specific, PIP related fee schedules, or, like daily rates. And that is going to have issues around state specific mandated allowables, right? So all of that is, really leading to expecting our staff to be able to do all of these things, in addition to, the depleted talent pool and the, administrative burden. But also, when we're talking about patient retention, we also have to talk about, the additional services that we're rendering in an office, which is fantastic opportunities, to retain patients, because patients want a one-stop shop, right? They want that, that electrical stimulation. They want that ultrasound. They want that, laser therapy all in here. And that helps with, staff retention. But again, all of that, has downstream ramifications. And then I just want to also make sure that everybody understands that with the end of the pandemic, that on May 21st of 2025, CMS announced plans to substantially increase both the pace and the scale of audits with Medicare Advantage plans, because they have assumed that during the pandemic that, they think that there was significant overuse of things like the 25 modifier. So if we are doing exams in the office and then treatments as well, we have to have justification for those additional services. So we do really want to be cognizant, if we've got a large Medicare or Medicare replacement, we have to understand the requirements that Medicare is setting forth. So again, 6 months, 8 months later, we are not in an audit. So I would like to pause just for a moment and leave it open, if, Malika, we have any questions out there, and to see if, I can pause. I know that was a lot when we talk about staffing burden. Do we have any questions out there?
Hi, Christine. We do not have any questions just at the moment.
Okay, perfect. Then I'll keep going. Feel free to put questions in the chat if you guys have any. And Malika can always stop me. And I think that's going to lead me into our first poll. So my next section is going to be talking about how we track the health of our business. So today, do you track any specific key performance indicators that measures the business, the overarching business, or patient throughput of your practice today? So I think in the in your section, you should see something that leads to polls, and you can put your answers in there. So it does look like we have a couple people answering. It's kind of a mixed bag, where some people are measuring their key performance. More people are tracking them than not, but we also have a couple of people saying that they're not sure, which is fair, right? Oftentimes, we are tracking them, but not necessarily in sort of a routine, measured way. So let's go into that, because this is one of the most important things to looking at, the health of your business. And I'm going to start first with financial performance. And in the next slide, we're going to go into sort of more operational performance. So, how do you know that your staff is burdened, and that burden escalates to a crisis, right? Tracking the health of your business is imperative, and it's not certainly easy. So this can be one of the biggest advantages to partnering with a billing company, because if you are working with a billing company, they should be giving you a lot of these benchmarks, and and making sure that you are tracking your cash is imperative, because if you are a cash-based business and not dealing with insurance, your cash is realized in real time. But when you're dealing with insurance, your cash is delayed sometimes 30, 40, 60 or days or longer, especially with, your, personal injury, work comp, that can go on for a very long period of time. But your bills are still due every month, right? We still have overhead that's expected. So managing that cash flow is going to be important, to making sure that we have those cash reserves. My personal favorite is what we call average reimbursement per visit. So, or RPE, reimbursement per encounter. And so this is done over time, where you're not doing this on like, well, I saw Christine today, she's got Aetna, and Aetna gives me a daily of $55, so my average reimbursement is $55. Really, what we are looking at is over time what your average reimbursement per visit is. Because what I hear when I'm consulting with practices, the biggest complaint is, I am busier than ever, but I'm making less money. And while payer reimbursement is a constant concern, because we do know that they're constantly fluctuating the rules to get paid as well as their reimbursement, oftentimes we are not seeing less cash because of decreased reimbursements. It's because of how we're managing our AR, and we could be leaving money on the table. So realistically, what I want to focus on with this average reimbursement per visit is, if you take the total number of encounters, so let's say I saw 100 patients, and with those 100 patients, I collected $100,000. My reimbursement per encounter, or average revenue per visit, would be $100. So that's an easy, right? 100 visits divided by 100,000, or I think it would actually be $10,000, is $100. So I will tell you, and people are so surprised by this statistic, industry standards for chiropractic, the range is $65 to $110 per encounter. And I get cross-eyed looks all the time when I say that, because the response is, there's no way, because my average daily rate is $55. But you are not considering also all of those ancillary services, right? Your E&M codes, your imaging, your, electrostimulation, any of that kind of stuff, that's going to add to your reimbursement per encounter. That's why you do this over time. So this is a great benchmark. If you take a look at how much revenue you brought in last month versus how many patients you saw, then you can see how you're benchmarking against that industry standard. And generally, I don't like doing it over a month. I would do it over a 3-month range, because we know that payments are a lagging indicator. So that's, you have to wait for those payments to come in. So that's one of my favorites. The other one is days in AR. How long is it taking for you to convert seeing that patient into actually making money on that visit? Average days in AR with chiropractic should be about 24 days. So, but again, that can vary widely depending on how much PIP work you do. So oftentimes I ask my staff to carve out the days in AR between the insurance-based business versus the PIP, right? Because really those days in AR are related to what were the non-PIP work. So again, these are things that if you are working with, a seasoned biller, they should be able to provide you. Another big one is the percent of AR over 60 days and under 60 days. So certainly by the time you're hitting 120, the chance of reimbursement goes down astronomically. Really what I want to do is I want to try to liquidate my insurance AR in 60 days to the, mostly liquidate, right? So I do not want more than about 20%, 30% of my AR over 60 days, right? Which means 60 to 70% of my AR should be within the 0 to 60 bucket. There are a lot of other potential factors that you can look at depending on how your business is, right? Rejection rate. What if you take a look at what is rejecting and what isn't even going to the payer or starting that process, and what are you having to fix? I can tell you in chiropractic, the two biggest things as to why a claim gets rejected either at the clearinghouse or at the payer level is eligibility, right? Patient not found, because patient doesn't have, Freedom Blue anymore. They got rid of their Medicare replacement plan and they're back on fee-for-service Medicare, right? We're coming in to Medicare open enrollment in the late fall, and we're going to have that. Or somebody got a new job and they don't have Blue Cross Blue Shield, they now have Aetna. So those, or we key something wrong in, and I did not, spell, I have this all the time personally, where people spell DeFrancisco with DE space Francisco. That's going to reject as patient not found, because my name is DeFrancisco without a space. So really, that's where the key to having people at your front desk or doing that, financial clearance of checking eligibility, checking benefits is so critical, because you will stall your money out if you can't even get it out the door, because we have rejections based on eligibility. And then, there are a ton of other key performance indicators. I have listed them here. If you have any questions, we'll be opening up for questions again in just a minute. But to keep things moving, it's not just tracking the, where your money is in the cycle of being paid. It's also taking a look at those operational performance, right? When we're competing against larger groups or market saturation, right? What did we say? 38,000 chiropractors practicing in the US today, that, you have to track that marketing component, right? What is your new patient volumes? Like, how many people are you bringing into your practice is going to be super important. But another key one that I always talk to providers about is taking a look at your no-show or your cancellation rate. If you have a 20% no-show or cancellation rate, that means providers have gaps in their schedule. And if they have gaps in their schedule, those are gaps that could have been filled with patients. And now you have a provider sitting around and not working. They're not seeing patients, they're not generating revenue. And of course, another key one that I love in chiropractic is that reactivation rate, right? You can get new patients in the door, but if you are not bringing them back for a course of treatment, then again, you see a patient once and you could lose, 24, treatments with them. Or potentially even, like I said, my dad is 80 years old, still goes to the chiropractor religiously because he has chronic pain and it helps him. So you could have a lifetime of a patient. So tracking those appointment matrix is going to be really important to the overall health of your business. It also tells you how to staff, right? How much staff do you need? A big one as well is point of service collections, and that's twofold. Number one is if it's what I call a factor of two. If you do not collect a patient liability at the point of service, you are going to lose 50% of that money if you have to wait for the insurance to pay and then balance bill that patient their liability. So if you know a patient has a $20 copay or they have, a share of cost through a deductible, you have to, know those benefits. Your front desk has to understand how to read them. talk to the patient about why they owe money today and then collect it. Because if they have a $20 copay on a $60 visit and you are not collecting that up front, that $60 visit, you have 50% chance of collecting it if the patient gets a statement, which means, the average for that reimbursement per encounter goes down to about $50. That's a huge, when you are talking about a volume-based business where you can be seeing 300-400 patients in a month, you could be leaving, $4,000 or $5,000 on the table. So understanding that point of service collections, again, means that your staff has to have the bandwidth to have those conversations with the patients. They have to be competent and skilled enough to understand how to speak to a patient about, payment is expected at the time of service. And oftentimes that's a pivot for our front desk people to be comfortable having those conversations. And again, one thing that these bigger groups can do is really sort of go out to their patient base and do things like surveys, satisfaction scores, what we call net promoter scores, right? So when you go to a large group, they're going to send you that survey either in the mail or on your phone. And you take the 4 or 5 questions, and they can do that on a global basis. They really can pivot their business based on what their patient experience is, right? And that's something that is significantly more challenging in the small market. And I understand that. Oftentimes working with marketing groups can help you do those surveys. You can even do it through things like SurveyMonkey. And another key and 2 other key things that I think are important in the chiropractic market is referral source tracking. Who are you getting your patients from, right? If you're getting them from things like Yelp or Google, that's great, but you could be missing entire referral sources. Like, who are the big internist groups in your region? Should you go out there, send flyers, let them know that, these are, especially if you're doing geriatrics, right? Internists focus so much today on geriatric care that you can talk about how you can help their elderly patients with balance, mobility, pain, quality of life, or you can go to your local, pain specialists to talk about, incorporating them into incorporating yourself into the palliative care model. So really being creative around our referral sources, but you have to understand where you're getting them from. And wait times. Wait times is a huge thing that I constantly hear when I'm consulting with practices. We lose patients because you have a 15-minute appointment and you made somebody wait 25 minutes for that. They're not coming back, right? Why would something that should take 15 minutes is now taking me 45 minutes, and you want me to come in 2-3 times a week? I'm not doing it. So really managing your wait times. And again, that goes back to staffing. How efficient are we at checking patients in, making sure we're scheduling patients in a way that we are not getting behind, and our providers are able to see patients on a regular cadence. So again, going back to our bespoke model here, you can see again how, tracking our KPIs really is so important to bringing cash in the door. And again, this is incredibly heavy on those payer complexities, right? To understand, our payer policies, to understand what we're being denied on, tracking our coding and billing changes. All of that is what brings cash in the door. And we can't know whether or not we're doing things right from a billing if we aren't tracking those things. I know that this is one of the biggest challenges that we are facing today as small businesses, is having the time to run those reports and then understanding really what they need. And then when to understand what they need, how do you pivot your business, right? That's where, really partnering with a professional will get you to that next level in your business. So, poll question number 2 is, do you feel like you have a complete understanding of your practice's billing performance? So again, we're going to open it up to that poll section in our application here. I would love to have people sort of respond to this. So it looks like, oh, wow. We kind of have a currently a 60 30, like 2/3 of us say yes, we feel great about understanding our practice's billing performance, and about 33% of us saying that no, we could probably do a better job in that. That's actually really good, right? Sometimes I have these kinds of presentations and people are like, no, I'm not really tracking this. So, okay, that leads me to really how we refocus all of these challenges with this hockey stick growth in the market. How do we take advantage of that growth while balancing all of these staff challenges, which are not going to go away, and then having the challenge of, understanding where I'm falling down and where I can really leverage help. And I have mentioned this a couple of times throughout the presentation, and that's really leveraging economies of scale. So what economies of scale really means in the business sense is we are leveraging shared resources to reduce cost. So when you are partnering with a vendor partner or, an outsourced company, that allows the practice to tap into enterprise level efficiencies, but not paying for those overarching enterprise costs. For simplicity purposes, this would be like a shared resource. Like if you called some of your friends in your local network and say, hey, I need a part-time biller, and I have a great candidate, but she only wants full-time work. Do you need a part-time biller? And somebody says, yeah, I'll share that resource with you. So this goes back to that big group private equity venture capital model where they can, have this central business office model, or what we call CBO, central business office, where they can have a group of people doing the eligibility benefits, somebody else having an authorization department, somebody else doing the billing and the follow-ups, somebody else doing the patient statements, right? That these big groups and PE firms leverage those economies of scale. The way we can do it in the small market is partnering with experts in our business, right? So, billing partners invest in advanced software functionality that we as small business owners can't, like workforce management tools. A good billing company will also have remote process automation, or as you hear in the market, it's not quite AI, it's bots that will scrape data off. So they can have a bot, dump all of your rejections out of TriZetto into a workforce management tool to be able to efficiently work your data on a day-by-day basis. And they can do that very cheap because they're doing it across, oftentimes 100 of chiropractors. And then, of course, they can have entire teams. So they can have a team that just works on getting your claims out the door, a team that just works on payment posting, a team that just works on, getting those claims that are stalled or denied, getting those reprocessed and paid. And again, you may only need a part-time biller. And so are they experts in all of those systems? If you're partnering with a trusted billing partner, they will have expertise in chiropractic, and then they will have entire teams that specialize in this, but you are not having to pay for a biller, a payment poster, an AR follow-up person, and they can, you can leverage those economies of scale. There's also a level when you do this model of cost predictability, right? Generally, you are going to know how much you're bringing in, what your percentage is, and how much you're going to have to pay a month, right? It's very hard to have cost predictability if you're growing super fast and now you feel like you have to onboard a bunch of people. Now, when you're onboarding staff, that's taking away from your skilled labor having to do the training and really end up delaying their daily workload. So, it ends up adding to that unpredictability of how much you're going to have to pay. I already talked about the technology. Another big issue, and to me, in a small business, when I'm consulting with them, is this idea that we currently run a very single-threaded organization. We have one person working our front desk. They may also be a assistant, like a chiropractic assistant. So they're checking patients in, they're collecting money, they're scheduling. They could also then be doing the scanning, of the patient. They're making sure to wipe down the tables afterwards. That's one person, right? You may have one person doing your billing. And when you run a very single-threaded organization, when somebody goes on vacation, your person that's doing your claims goes on vacation, that means that potentially your AR stops. Who's getting claims out the door? If you're doing it as a provider, that means that that's taking away from your time. Or you could end up being, getting things rejected or denied because you are not an expert in billing. And so if that person quits, goes on maternity leave, now you're in a situation where you are struggling to figure out how you're going to get, again, that qualified staff backfilled. So when you are partnering with an outsourced billing company or a vendor partner, they have a multi-threaded approach. So any good billing team is going to have a whole pod of people doing chiropractic billing, doing the payment posting, being specialists on that AR follow-up. So if somebody goes out, you would never even know it because they have so many people in each sort of function of the revenue cycle. So what are the key considerations when you are going to an outsourced business model? So how do you know when it's time to make a change, right? When you start to have inconsistent collections where you in 1 month are bringing in $20,000, the next month you bring in $8,000. That, cash inconsistency is incredibly difficult to manage a business, right? And then again, it's hard to determine why you have inconsistencies in your collections. Is the money in the bank and somebody's just not posting those payments in to the ChiroSpring system? Or is everything sitting in rejections because your biller is out on vacation and that means the claims haven't even gotten to the payer for processing? So, inconsistent collections is the easiest, most simple way to know, but that is not the only one. And oftentimes, again, that concept that we are busier than ever and we are not making more money. And that's because we have our money stalling out with everything sitting in aged AR, right? Where our days in AR for our insurance claims are going out 60, 90, 120 days, and you don't have the staff to work those claims that need rework? And then again, are you experiencing that 40% turnover in your front desk, or 20% turnover in your providers? And is that staff, turnover disrupting your operations, which then, can lead to revenue leakage or cash leakage to the business? Are you concerned that you are not, sending things out compliantly? Like, you cannot balance bill a Medicare patient unless you have an ABN on file. Oh, does my front desk know that? Does my biller know that? Like, those kinds of things are really important. And we're coming in to October 1st, where we are going to have all of these, updates to the codes. So do you have somebody who's going to review the code changes for chiropractic to make sure that you're compliant? And of course, a lot of practices struggle with things like clearinghouse. We have the integrative Trizetto, but if you don't understand like how, when you're adding a new payer, how to make sure those EDI connections are established and things like that, that can really delay your cash. And of course, do you feel like your staff is unicorns, where they are everywhere all the time, and we have created a jack of all trade but the master of none? That's really where you can take a look at whether or not it's time for outsourcing. And I made this sort of like a checklist. I know we're running out of time here. So there are a couple things that you always want to look for when interviewing a billing team. Number one is you need to make sure they know your specialty, right? When you are hiring a billing service, ask them, how many chiro clinics do they have? How many chiropractors are they actually serving today? Because most billers will be doing OBGYN, cardiology, internal medicine, pain, and they'll say, well, we have, 800 clients. Well, how many of that 800 clients actually do chiro? Because again, our specialty has very specific requirements on how things work, especially if you're doing PI work. You need to have a billing company that understands that. And technology, right? You need to ask your billing partner, what are the platforms that they use? And if they say, oh yeah, well, we use our own homegrown practice management system or billing system, they're going to take all of that information out of ChiroSpring and put it in to their practice management system to get your claims out the door and work for it and work out of their system. You are not going to have optics into your AR. And so that becomes very scary from a business management. Ask what kind of tools they have for managing AR, for managing rejections, right? Any good billing partner should be tech enabled these days. And then another big one for me is dedicated client success managers, account managers. So many of these billers can be cheap because you will never talk to a human. And that it's our business. If you have significant issues, you should be able to have an escalation pathway of, okay, I put a ticket in, I'm still not getting a response, I need to speak with somebody. So, and then you can see, the checklist for all of the other things. I will say one quick note about client references. I don't hold a lot of stock in client references because you may have 200 clients and 2 of them are happy. If I give you 2 happy clients, it's going to seem like everybody's happy. And any good billing company is going to get you references. So realistically, oftentimes I don't hold a lot of stock when I'm talking to companies in my consulting world about their references. I do want to comment, I'm not here just to educate you, although that I'm very passionate about what I do, but I do want to let you know, because we're hearing more and more that people aren't necessarily aware that ChiroSpring does do revenue cycle operations. I'm the vice president of that division. And again, all of those things I mentioned on the last slide, we are experts in chiropractic billing, right? I have hundreds of billers, payment posters, AR follow-up team that work exclusively in my chiropractic space. That's all they bill on. And of course, all we work on is ChiroSpring and TriZetto. So we are integrated. I'm never taking information out of your system and putting it somewhere else. We do have our own tech enablement, but that is really in the background where we take the data and put it into our workforce management tools. But everything we do then goes back into the ChiroSpring system for you to see. So you will see the claims, you will see who worked on them, all of that. And of course, we have merchant services as part of our overarching service, our overarching service offering to you. And of course, partnering with various patient engagement is available as well. So with that, I'm going to hand it over to Malika to see if we have any additional questions.
Hi, Christine. Yes, we do have a couple of questions. I know we're hitting their time, so we're just going to ask a couple. What's the biggest mistake that you see practices make when trying to manage billing in house?
I think the biggest mistake is expecting people who understand Chiro to then understand billing, right? Where we have people who maybe our office manager or our front desk person then be expected to pivot from, being that one-stop shop for managing, the day-to-day function of your chiropractic operations, and then expecting them to understand the nuances of the difference between ASH and Blue Cross Federal. And, the differences between, the Medicare replacement plans versus fee-for-service Medicare. It is a very complex business today. And I think they end up waiting too long and they are at a state of failure before they reach out for help. If you are expanding more and more into taking insurance, you should look at partnering with an expert and letting your on-staff site focus on on-site functions like, patient engagement, patient retention, that, patient experience functionality that outsourcing really can't be done.
Okay, that makes sense. Which KPIs should a chiropractor track weekly versus monthly?
So realistically, weekly, the only thing I would be tracking would be no-show cancellation rates. Everything else, maybe mid-month, I would probably check, where you are in your collections and have your baseline expectations. Like I should be collecting $20,000 a month in net collections, and by mid-month, you should be at 10. What we find billers do is they will get everything done in the last 5 days. So at halfway through the month, you may only be at 3,000, right? If you are at that, you need to talk to your biller. Like you can get claims out the door that may pay in 15 days, like straight Medicare. And some of the commercials, if they're a clean claim, they'll turn them over quickly. But tracking your cash mid-month is good. But for all the other KPIs, monthly, except when you're talking about your reimbursement per encounter, that is should be done on a quarter basis, or you can do it monthly with a 3-month look back.
Okay. And then I have just one more question for you. If you could give every practice owner just one piece of advice about billing, what would it be?
Educate yourself, especially when it comes to coding. It is the provider's license that is on the hook for coding to the highest specificity, which is a big one, and you will be picked on by every government and commercial carrier if you are not coding to the highest specificity and you do not understand, when to add modifiers. And I know you don't go to school for coding, but realistically, most chiropractic businesses use about 20 codes. Familiarize yourself with it, understand the differences between them, and you will absolutely bring more cash in the door. And we will be having, because I brought Gina Shirato on as my director of quality and compliance, and she is an expert in chiropractic coding. We're going to have some of these webinars coming up, especially in October when the coding is going to be updated.
Well, we are looking forward to it. Thank you so much, Christine. Those were definitely some powerful insights. And we want to thank everyone again who joined us live today. Whether you're feeling the weight of billing in your practice or you're just exploring new ways to run more efficiently, we hope that this session gave you the clarity and tools to move forward. Now, before we wrap up, just want to let you know the replay is already available and will be landing in your inbox shortly. Please take a moment to complete the survey in that email. Your feedback again helps us to continue to bring you sessions that are timely, practical, and relevant. And if we did not get to your questions, or if you think of something afterwards, just feel free to reply to that email. We're so happy to continue the conversation. Now, again, thank you everyone for being here, and we will see you at the next one.
Thank you so much for having me, Malika.
Thank you, Christine.